Up first this evening, hospitals across the island are in full preparation mode for what is being described as an inevitable fourth COVID-19 wave due to the Omicron variant. Additional nurses and doctors are being recruited to the Southeast Regional Health Authority, as some experts say the new variant could cause a surge in COVID-19 cases. Kelisha Williams has that story.
Experts tracking COVID-19 were hoping for calm this Christmas season. Then came the Omicron COVID-19 variant in southern Africa in November. So much about this new variant is still not clear, but the World Health Organization has urged countries to prepare as Omicron could be highly transmissible. And Jamaica says it's listening. In the Southeast Regional Health Authority, for instance, more nurses, doctors, and other staff are being recruited.
We got approval for 300 plus. We have already recruited some over 200. And we have personnel now waiting to be interviewed. And it's from all categories. From doctors, nurses, nurses assistants, ancillary workers, just about everybody that you need to run a hospital.
During the peak of the third COVID wave in August, the island battled a critical shortage of medical oxygen. Now steps are being taken to increase supply.
As you know, we had a challenge in March and February, March, and again in around August, September. So we have met with IGL. We are looking at other options, and in some hospitals, they have already put things in place, though they might not have been able to respond as quickly as IGL would be, but they have put things in place to ensure that we have adequate oxygen supply to run these institutions.
Over at the Mandeville Regional Hospital, renewed hope. The hospital has moved from 150 COVID patients in isolation in August to 6 in December. But the senior medical officer, Dr. Everton McIntosh, said all that could change with the impending fourth wave.
Somewhere at or after Christmas into the new year. And so we have to maintain the protocols, ensure that we continue our social distancing, mask wearing, hand sanitizations, and so on. And I must, as a clinician, someone who is on the front line, who sees it every day, we must encourage our population to get vaccinated.
So far, the Omicron variant has been detected in 38 countries. Kelisha Williams, TVJ News.